Hi, it's Suzanne Chan from Mom Confessionals, and today I am putting on my labor and delivery nurse hat. So I wanted to do a little piece today about being induced. So I've had a lot of friends ask me, what does it mean to be induced? So that means some of them have had pregnancies that didn't quite go the way they wanted, or that they just actually wanted to be induced, and that's what we call an elective induction. But what does that mean? So there are many different reasons why you might get induced. Sometimes there are issues with the baby and that your doctor might want you to get induced. There might be issues with your own health that might cause you to be induced. So things like the baby being too small, which is small for gestational age, or intrauterine growth restriction. And then issues with you, which could be glucose issues. You might have gestational diabetes and the baby's getting too big, or you might have some blood pressure issues, which is hypertension. You could be pre-eclamptic. So there's a whole spectrum of reasons of why you would get induced, and you can also choose to get induced. Of course, legally you can't do that unless you're at least 39 weeks, and depending on the facilities, they have their own individual policies and rules about that. So what does it mean to be induced? Okay, so you're basically asking your body to do something it wasn't quite ready to do. Because if you know, when you're in labor, you know when you're in labor, you've got all the contractions, and I'll actually even say that sometimes if you're a first-time mom, you don't even know that you're actually in labor. You're gonna have cramps, you're gonna feel like you have a stomach ache, you might have diarrhea, and you just probably think you ate something bad. But really, you're actually in labor. So when you're doing an induction, you're actually asking your body to do something it wasn't quite ready to do. So what you're asking it to do is by giving it some medication to actually see if you can trigger and start the induction process, to start the labor process, I'm sorry. And there are different methods that you can use to start an induction, okay? And usually it starts with a prostaglandin induction agent. Before I go into that, we all know that you have to be 10 centimeters dilated to have a baby, okay? But a lot of times when you hear your doctors talking, they're saying 3 sets of numbers. They're either saying you're how many centimeters dilated, what % effaced you are, and what station you are. And you're like, what does that all mean? At the end of the day, all we want you to do is get to 10 centimeters, 100% effaced, and +1 or +2 would be fantastic. But what does that mean? So if you think about your vagina as a wall, okay, and I'm gonna get a little TMI here, but basically the only thing that has probably ever gone in that region is a tampon and a penis. And if this is your vagina, you can think of this part as your cervix. This whole long part right here is your cervix, okay? And basically you need the cervix to thin out to nice thin, and then for you to start dilating, okay? And so those are the 2 numbers, how many % dilated you are and how thin your effacement is, how thin the cervix is. If you can imagine, if your cervix isn't thinning out, dilating really isn't gonna help you, because you really need the head to come down too. So that's the 3rd number, which is the station, which starts at -3, -2, -1, 0, +1, +2, and +3 on your way out. When you're at 0 station, pretty much means the baby's head is engaged in the pelvic bone and like ready to come out. And that's the hardest part for the babies, to actually get under that bone. But I'm getting a little ahead of myself. So when you get induced, we use something called a prostaglandin induction agent. And there are a few that we use. We use something called Cytotec, which can be given vaginally or orally. And we also use another thing called Cervidil. So Cervidil is super expensive, so we don't really use it that often. But Cervidil looks like a tampon, and it goes up there and it stays up there for about 12 hours, and then you take it out and you hope that something has been done, okay? And then the other method is Cytotec, which is oral, which is a drink that is given in a specific time sequence. Different hospitals have different sequences, but at my facility we do I believe we do 3 doses of 20, 3 doses of 40, and 6 doses of 60, which is for a total of like 24 hours. And of course, at any point during the process, we can reevaluate and move on to the next step. But so there's the oral Cytotec, and then there's the vaginal Cytotec. Now, the vaginal Cytotec is a little bit more aggressive in the sense that you just put it right up there near the cervix. But I've also seen where it doesn't get placed in the right place, it falls out with fluid. So there are other things that are uncontrolled with that. And the good thing about oral Cytotec is you can just kind of stop it. Like, it has like a nice quick half-life, which means it's pretty fast acting, short acting, I guess. So you're kind of giving it every 2 hours. And that's the primary goal, is to soften the cervix. That's the effacement that we talked about before. And when you soften the cervix, then you can kind of dilate. So as a bonus, sometimes with the prostaglandin induction agent, the Cytotec or the Cervidil, you get a nice little contraction going as well. So that's the bonus. The primary goal is to soften the cervix, okay? Some people, after they go through all of that, it doesn't really work. And there are other methods that they can go about to do and help you along. One of the things that we use in our facility is a cervical balloon. So a cervical balloon is painful. I haven't heard a single patient say it's not painful. And if you're lucky, your facility will offer you an epidural or some sort of pain medication before they put it in, because basically you're putting in a balloon and inflating it between your cervix area and trying to manually open it up. And so it sounds just about as painful as it really is. So that's an option, and usually they do that with Pitocin. So Pitocin, a lot of people have heard about Pitocin and they get really scared about Pitocin. But Pitocin is actually a synthetic form of a hormone that your body actually makes in labor. So Pitocin is oxytocin, and oxytocin, as you know, is what causes your contractions, and it's a hormone that your body makes when you're in labor because it kind of tells your body what to do. And Pitocin is actually very controlled. Okay, it's super fast. Like, the minute you turn it off, it's done. The minute you start it is when it starts. And we often start at a very small and controlled dose, and we increase it slowly. And each hospital has their own guidelines for that. So if you want to do research on that, you can. But basically, Pitocin, their primary goal of that medication is to cause you to have contractions. And why do you need contractions? Because if you have a contraction every 10 minutes, you're really not in labor. Because if you think about it, if you were a rubber band, and this is the rubber band, and you're stretching it once, and then it goes back and nothing happens in 10 minutes, you're not stretching. So what we want to do is stretch, 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 and then eventually you start dilating to 10 centimeters, which is where we want you to be. And that's the goal of Pitocin, to get you into a controlled pattern where you're like stretching so much that it just kind of loosens up, like a pair of really stretchy pants that lost its stretch. And that's what's gonna get you to 10 centimeters, 100% effaced, and +1 or +2. And I say that because I know that some people think, oh yeah, you're at 0, that's fantastic, you can start pushing. But if anybody ever tells you that and you're a first baby, please tell them to let you wait a little bit longer, let that head come down a little bit more, and let nature do what it knows what to do, and get that baby out with less effort and less work, okay? So now you're asking, once you get to 10 centimeters, what happens? And you're ready to push, you're +1 and +2. It's important that you start pushing, but you only push when you have contractions, okay? And that's the very important piece that I always tell my patient, because if you're pushing when you don't have a contraction, like, you're just doing twice the amount of work, because your body is so smart. Your uterus actually is like, if you think about it, well, think about it like a pyramid, kind of nice round pyramid. But the muscle actually is like, starts at the very, very top and helps you to push it down, helps you to push the baby. So you want to push only when you have a contraction, so you don't do twice the amount of work. Okay, so that's it for my educational piece on what an induction is. And if you have any questions or any input, let me know, and I will be happy to answer them.